Hi, it's Dr. Eric Robbins. I'm a pain specialist on the West Coast, and I wanted to share with you a very interesting case report that I think illustrates a lot of very useful principles in treating pain using mind-body healing concepts. So this was a guy in his 30s who had a very severe pain syndrome. There's a couple names for it. One is RSD, reflex sympathetic dystrophy. Another name is complex regional pain syndrome. And in this syndrome, the nerves in the body become exquisitely painful and hypersensitized. In this guy's case, almost if you dropped like a paper clip on his leg, he'd be in bed in 2 days immobilized. So very real severe physical pain. Now, we have our usual pain scale from 0 to 10, with 10 being the worst pain. This guy, on the pain scale, his pain was a 20 out of 10. It was off the charts. So he spent many years seeing all the best pain specialists on the West Coast, doing all the standard medications, all the standard of care treatments. And at the end of many, many years, his pain had gone from a 20 down to a 15, which is obviously just horrible. For a number of years, some of the specialists wanted him to see an integrative pain psychologist, and the guy adamantly refused because he was sure that they were going to tell him, quote, the pain's all in his head, which is actually not what they told him at all. Finally, out of desperation and years of suffering, he's the sweetest guy, he finally agreed to meet the integrative pain psychologist. The pain psychologist explained a concept to him that was very interesting. She said, I want you to, I know you're having very severe pain. We're not judging that, minimizing it, but I'd like you to pick a part of your body that doesn't hurt and just shift your awareness and attention to that. And the guy goes, no, you don't understand. My pain's so severe in my leg, I can never switch my awareness and attention. And she goes, I understand that. And she said, all of us naturally, when we're having pain, our attention goes to that area. She goes, I get it, But she goes, I want you to imagine there's like a vinyl record, the record that plays on the record player. And obviously you put the needle in the record and the record goes around and the needle rides in the groove and plays the music or whatever's on the record. So she goes, if I were to take like a sharp knife and make a deep scratch in that record, then obviously every time the record circulated and the needle hit that deep scratch, it's going to preferentially drop into that deep groove or that deep scratch in the record. So she said one of the challenges with chronic pain is because our minds and our attention naturally go to what hurts, but our attention gets more and more focused on the pain, and we're thinking about the pain, and it's as if we're making deep scratches in the record so that after a while it's hard to notice anything else. And then the pain keeps getting more and more and more magnified. So once she kind of explained this metaphor to this guy, she said, listen, I'd like you to shift your awareness and attention to a part of your body that feels different, that feels good. And he begrudgingly did that. He realized, gee, actually my entire other leg feels okay. And then he immediately switched back to the part that hurt because that's what his mind was very attuned to. Oh, and then he, to his credit, began to notice, gee, I can shift my attention for short periods of time to other parts of my body, and actually noticed that a number of other places in his body actually felt pretty good. Over time, he got better at shifting his awareness and attention away from the area of pain. He wasn't minimizing the pain, judging it, but he was learning to train his nervous system to focus on other parts of the body that actually felt good. Now, believe it or not, this technique was the beginning of the end of his pain. Over time, working with this integrative pain psychologist and doing this pendulation, that's the name we give for this, he got his pain from a 15 down to a 7. That is amazing and amazing after years of suffering. Now, we use this concept of pendulation a lot, okay? When I see folks with anxiety, for example, I'll say, I start with, say, notice the part that feels anxious, and I want you to notice the raw physical sensations of the anxiety in your body, okay? Now, I use that wording because a lot of times people feel an unusual, strange sensation in their bodies, and what our minds do in a millionth of a second, we label it. Oh my God, that's this, that's that. That's anxiety, that's a medical problem. We start asking all these what-if questions, and our way of thinking about the sensations stirs up our fight or flight response. And, when our body's in a fight or flight physiology, the increased stress hormones sensitize the pain fibers, sensitize the anxiety, and it becomes a continuing spiral. So I'll have my anxiety patients notice the raw physical sensations in their body that they're labeling as anxiety, and then I'll say, find a part of your body that feels good and feels safe. And almost everybody with anxiety can find an area like that, and we'll have them shift their awareness and attention. That's very important because just realizing that even when we're deep in our stuff, we have the ability to shift our awareness and attention to other parts of our body that feel safe. For most of us, we may have a good a good proportion of our body that feels good and feels safe. Now, admittedly, some of my chronic pain patients, like with fibromyalgia, the only place in them that feels good and safe initially is the little toe and the right foot. And so we'll notice that and pendulate to that. And then we'll notice the parts that feel bad. This is building neuroplasticity. This chronic pain patient, the reflex sympathetic dystrophy patient, was building his neuroplasticity, okay? He was basically sanding down that deep groove in his nervous system that kept all his attention focused on the pain and the depth of the pain. And then he was almost, by focusing on what felt good, he was building new neurologic pathways, new grooves for feeling good. That was the beginning of the end of his pain. This pendulation is an extremely powerful practice. There's versions of it they talk about in the Sedona method with holistic releasing. A number of different schools talk about it. In medicine, in the field of neurology and psychology, we talk about this neuroplasticity, which is building new pathways in our body for feeling pleasure, for feeling happy, for feeling good. A lot of folks that are depressed, there's big superhighways of pathways in our brain and nervous system for feeling bad, and it can be a process and take a while to focus on things that feel good. Now, that's not being a Pollyanna. By the way, I used to have patients in the office. I do some therapeutic work with them. We might do some tapping or some TAT, which is the TAPAS acupressure technique. Or we might do the TREs, Dr. Berselli's tension and trauma release exercises. And when they left the office, I'd always tell them, I want you to focus on what feels different and better. And to be honest, for many years, I kind of felt disingenuous saying that. I'm like, Eric, you're kind of wanting them to make it up, and that's kind of a little BS. Now I realize with the principles of neuroplasticity, if we give our brain something different and better to look towards, A, it will find it, but B, by forcing our brain to experience, especially giving our brain a target and an opportunity to notice parts in our body at this moment, it's a very, very powerful practice. We're building up the feel-good pathways, hopefully over time, sanding down those pain pathways. It's extremely powerful practice. And in the end result with my chronic pain patient, we did Dr. Berselli's tension and trauma release exercises. That brought his pain from a 7 down to 1. Those exercises, when done slowly and safely, tend to turn off the body's fight, flight, freeze, stress physiology that almost always contributes to chronic pain. All right, guys, thanks for listening.